Hello, my name is Robert Lookstein. I'm an interventional radiologist working in New York City. And I'd like to share with you just a very interesting case from my practice recently where the Sublime balloons really honestly saved the day. The case I'm going to share is it's a somewhat rare case, but I think it demonstrates the power of this new technology. This is a case of a 58-year-old patient of mine who has end-stage renal disease. And he presented to my office complaining of several weeks of upper extremity hand ischemia. Specifically, the patient had ischemic pain at rest in his hand and had a breakdown of the skin in the tufts of the right third and fourth digit. We attempted an endovascular revascularization several weeks ago, and unfortunately, all the equipment in my lab was unable to reach the target in this patient from a transfemoral approach. Of note, the patient is quite tall, over 6'4", and I just had no equipment that could reach. So I did a very, very detailed search of new equipment that had been commercially made available in the United States. And I looked at the Sublime line of rapid exchange angioplasty balloons, and I thought it would be a very, very good piece of equipment to use for this particular patient. This was our diagnostic angiogram, and as you can see here, the radial artery is moderately diseased, but of note for this particular patient, the ulnar artery is diffusely diseased and tapers out at the level of the wrist, and is in fact not in continuity into the palmar arch. There's pronounced ischemia again in the third, fourth, and even fifth digits here on this angiogram. We chose the ulnar artery as the target lesion for this case. We actually used a 6 French long guiding sheath by Surmodics, which was able to get us into the brachial artery, and then we were able to easily deliver a 2 millimeter angioplasty balloon into the distal ulnar artery, as you can see here. This balloon was used to prepare the lesion. We used this essentially from the wrist all the way back to the proximal portion of the ulnar artery. We were then able to upsize the balloon. This is a 2.5 millimeter angioplasty balloon extending all the way into the wrist in this patient. And again, this is a very, very easily deliverable angioplasty balloon. And prior to me obtaining this equipment, I really was struggling on how I was going to be able to repair this patient. This is a fixed angiogram demonstrating the wire access that we were able to obtain with the use of the guiding sheath through the distal ulnar artery into the palmar arch and actually retrograde into the radial artery. And this was the final result that we were able to achieve here. You can see that there's just marked improvement in the circulation to the patient's ulnar artery and much more rapid filling of the digital vessels in the patient's right hand. Honestly, without the use of the Sublime balloons, I don't think I would have been able to treat this patient. So it's just a huge benefit for all patients with distal to treat lesions. I've now seen this patient follow up at 2 weeks, and he reports no pain at rest in his hand. We actually have him in a very, very aggressive wound care surveillance program right now. We're going to keep a close eye on him. But just wanted to share that with you, a great case where the Sublime angioplasty balloons was able to treat a particularly challenging lesion. Thank you very much.